just more pictures of the same.
Scott Tabish was just 19 when he went to war in Vietnam. He spent 11 months in combat, and he and his friends never imagined they'd make it out alive. When Scott came home, he wasn't the same.
When I came back from Vietnam, I was in a combat zone one day, and 2 days later I was home. And for 2 years was pretty much withdrawn from family and even friends, but it's just the way it was, and that's how we felt, because back then there was no such thing as PTSD that I was ever aware of.
Now, 50 years after coming home, Scott is one of 1,000 veterans each year who come to the Salt Lake VA's PTSD clinic, which specializes in the diagnosis and treatment of PTSD. Dr. Tom Mullen, the program manager and section chief of the PTSD clinic, says veterans often come in when the impact of past experiences affects their life in detrimental ways.
To the point that it really makes it difficult for them to do the important things in their life, like engage with their family, go to work, do the important, meaningful things in their life.
The PTSD clinic offers several types of therapy endorsed by trauma-focused research groups and the VA Department of Defense, including peer support and even equine therapy. After doing some research, Scott signed up for cognitive processing therapy, or CPT, and did his sessions at home online through the VA's telehealth option. It wasn't easy, but Scott says it's worth it, and he hopes his story will help others.
I mean, it's life-changing to see ourselves. I would say don't wait 50 years. I'd say if there's an opportunity to prevent what I've gone through with my family so you don't have to go through it, this is it.
There's not really a magic bullet for this. It's hard work, and the therapists in the PTSD clinic do ask our veterans to do some hard work. We can see the benefits, the strong benefits of this, that when people come through a formalized evidence-based treatment in the PTSD clinic, we can see, about half of them on the other side of this no longer have a diagnosis of PTSD. There is hope for this.